Thank you for sharing, everyone. Um, so today's going to be a part one of a two-part series of our learning series around mental health and well-being. Before I kind of go into what our hopes are for today, I'm going to start with a land acknowledgement. With many of you know, this is common practice for Sound ACH. But before I do that, I just want to take a moment and ask that we hold Tulalip tribe in our hearts today. Sorry. This one hits home for one of our staff, and I just hope, sorry, Stacy, I thought I could do it, but I just want to ask you to all hold them in your hearts today as they're waiting for news. There was a water rescue last night that has left a tribal member missing, and one of the rescued members is, related to one of our staff. So I just would love for you all to take a moment to send some prayers and well wishes to Tulalip tribe, and we're holding on tightly to our staff person today. So Stacy assures me that today's topic is really helpful for processing things like that. So I just want to take a moment for Tulalip tribe. Okay, so for our land acknowledgement, I'd like to begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, and valleys and mountains of the traditional homelands of the Coast Salish people since time immemorial. It is also Native American Heritage Month, and Hillary's going to put a post. We've been trying to share some resources and some wonderful events that have been happening. Our staff in particular are really looking forward. Tomorrow is a showing of Dawnland, and there's free registration, and we are going to be participating in that and watching that, and all looking forward to that tomorrow, or today's Wednesday, tomorrow, Thursday evening. So our staff, and there's still registration open. Okay, so I'm gonna just briefly revisit what our aim is for hosting these learning series. We know that we're all impacted by COVID and other events happening right now, but we also know that the work continues for other topics. And so our aim is to continue to support ongoing learning by bringing in subject matter experts, but also holding space for all of you to share your successes. So each time we're really intentionally making an effort of sharing national frameworks with local stories. And for this topic in particular, there's such great work happening, which is one of the reasons we've split this into two. So today we'll be focused mostly on some of the national framing and the national efforts happening. And our next webinar will be focused on the local examples and the incredible work that's happening here in the North Sound region. We've shared this before. We're really aiming to leverage the Thriving Together core concepts of legacy work, vital conditions, and stewardship. We're looking to apply core concepts to deepen shared understanding around mental health and well-being. Today and the next webinar, really looking to lift up ways to reimagine mental health system, explore new ways of meeting mental health needs by sharing national and local stories. As usual, we want to continue to build relationships within our own region and really want to provide that space for you all to learn from one another and to continue to facilitate some learning and resource exchange connections. I also remind you that our learning series is posted on our YouTube channel. And so if you have coworkers who aren't able to make today, this will be recorded. And Stacy, I think I'll turn it over to you. Thank you.
Thanks so much, Nicole, for getting us started, and those of us both sort of near and far traveling with you all in heart and spirit. and with your community today. And Erin, if you wouldn't mind advancing the slide, thank you. I did drop a quick note confirming, thanks for forecasting the next section on December the 9th at 11 a.m. And you can register through the website as partners typically do. Look forward to seeing you back then as well. But today, just super excited, and again, in the context of community, to have these two just absolutely wonderful human beings with us, and Tyler Norris, who is the lead for Wellbeing Trust, and Trissa Torres, who will be helping us think about mental health and well-being, how we sort of got where we are, opportunities for moving forward, and really shifting from the much of the pain that we see in the nation to how we might move forward in healing as a nation. Next slide, please. I'm going to take just a few minutes to help ground us perhaps in a bit of some of our guiding principles and frame in thriving together, and then hand it right off to Tyler, who will get us started, and Trissa, who will help move us into then more of an open conversation. Next slide, please. For those of you who joined us last month, Monty spent a little bit more time unpacking the Thriving Together work and how it came to be. So I encourage you to go back and watch the food session if you weren't able to participate with us on that day. It is a wonderful piece, and Paula Daniels, just a tremendous asset with a lot of local community work and stories around the food systems and food sovereignty, et cetera. So welcome you to jump back there. Next slide, please. But just to hit a couple of the key concepts from Thriving Together, kind of orienting in the top right-hand corner of this particular graphic. We're not going to go deep sort of with each of these pieces, but want really sort of directionally to be talking about thriving, of our overarching goal, that which brings both unity and can be measured, really is all people, all places thriving, no exceptions. We know that the science of thriving helps us to understand those who are struggling and suffering, as well as those who are thriving. And our work is to help lift and provide the conditions in which we can move all people and places from struggling and suffering to thriving. We know a part of this really work to be shared and advanced collectively will also require some renewing of our civic life, our economic life, and our social, emotional, and spiritual life. Next slide, please. A couple of the key pieces really that are going to be essential in this work. And the first of those is thinking about our legacies, really that recognition that we all inherit a set of legacies. Some of them have helped to advance us, born of dignity and inclusion. And there are many legacies that we've inherited that really have inflicted harm and have been rooted in deep exclusion. But it's within our reach really to create anew. And what we do today will help set the legacies for which our next generation inherits. Next slide. All of this work really is, set and reinforced by the vital conditions in community. Our well-being is not driven and solely based on individual choice, but those choices, as we well know, are significantly influenced by the conditions, the properties of the places we live, work, and play, and that those vital conditions like clean air and water, basic health and safety, reliable transportation, humane housing, that those pieces are essential for our individual and our collective thriving. Next slide, please. and that we all have the opportunity to act as stewards in this work, both in the actions that we take, investments that we make. We will be leaving a legacy, and the choices that we make today will have significant influence on whether or not we're able to meet that unified goal of all people in all places thriving. Next slide, please. I'd like to take just a moment to note that the Thriving Together work, the invitation that came from federal colleagues, that outreach first landed in Tyler Norris's lap, who you'll hear from next, and with our colleagues at CI, with Monty and folks at Rethink. And as our federal partners ask us to think together and across our networks about what it would look like to move into recovery and on into resilience as communities. Bobby and Monty and Tyler, in collaboration with more than 100 other voices, from community members to organizations, faith institutions, tribal nations, and beyond, help speak into what might be possible in our Thriving Together. And Tyler is going to take us a step closer to look at those contributions and thoughts about well-being in particular, and how we can really sort of move away from violence, trauma, and addiction. So Tyler, handing it off to you.
Thank you, Stacy. That was a really beautiful welcome, and thank you for setting such a tone for this conversation today. It's great to be here with you. We've had the chance to serve together in communities for over a decade, and to see other friends and colleagues here. I'm looking forward to my friend and colleague Teresa speaking, Liz Baxter. We've gotten to work together before. I see other friends here too. I won't call everyone out, but it means a lot to me to have been included in the work you're doing in your community. So thank you. And I hope that having not been in a deeper conversation with all of you, that what I say is useful, and maybe the dialogue will unfurl that. Nicole, I want to thank you for bringing that update to us. This was news for me, and you put your finger on the heart of what I hope we root ourselves in today. Before I get into all my slides and everything I was thinking about, let's just begin right where we are right now, is that without human connection, we're bereft. We say, hey, let's get connected with each other, connect with nature. We're already connected with each other, and we're already connected with nature. Our identities are the same. Our mutuality is the same. The very question of who we are as a human being is what's on the table here. So when we experience loss or violence or trauma, and our heart breaks open, we're reminded of who we are as human beings. And when we're humbled by beauty in nature or by anything that throws us, we remember who we are. And I love the language of legacies and being stewards. And yes, we are all that. But first and foremost, we are human beings that are inextricably connected with each other and Mother Earth. And so thank you for beginning by bringing us into a reminder in this sad moment, a moment of hope, that we be vulnerable enough to remember our core identity. Because outside of that, we can talk about practice changes in organizations, policy changes, local, state, and federal. We can try and bring more money to these solutions, but we keep forgetting, when we forget who we are, there is no solution from the outside that's gonna ail what is really going on underneath these so-called deaths of despair. Because we talk about alcohol, opioids, and suicide, but what's really underneath that for our well-being? And I think that's on the table. So I join you from Oakland, California today, and I recognize that I am sitting on undeeded occupied land of the Ohlone people. And as a city whose heart is broken open every day for one thing or another, as I look out my window, I join you in solidarity, both with suffering and an extraordinary sense of hope, and sense that together we can accomplish things that matter for all of us. So I just ever so briefly, I'm often reminded I'm blessed to have two 20-somethings children in my life who remind me all the time that I have spent their entire life working to improve the health of people and places. And that my daughter, who's 27, reminds me often, referring to Institute of Medicine reports or reports about decreasing lifespan or deaths of despair, whose basic question of me in a beautiful daughter way is, what have you been doing? How are we here with, after a century of rising lifespans, that our systemic racism, our underinvestment, our system failures, our lack of mobilizing community and political will are landing us in a place that we're going backwards, and that me and my generation and my kids, Dad, are likely going to live less? What are you leaving us? And it makes me ask this question on our watch while we are in this steward role. What's with us? And I say that tongue in cheek because it's funny to say, or to say that, what's with you? But it is the absolute spot on truth of the challenge that she and our generations that are rising are asking us is there. I'm just going to ask that, do I need to advance my slides, or can that happen?
Thanks, Tyler.
Probably ask. Thank you.
Right. Erin has you covered. Just make note whenever you're
Hi,
ready.
Erin. So good to see you. So that's my slide, thinking about Eliza and our young people asking us what it's going to be. And the next slide is really about the data. And I don't think any of us need to be reminded that these death rates have doubled. For some populations, they have tripled. We know who we're talking about here, and what's underneath it is loneliness and hopelessness and isolation and exclusion and racism and all the things that we know are actually the fundamentals. And we're going to talk about practice changes and policies and investments. And yet what's really underneath this goes to the human condition. As we go to the next slide, and I'll just thank you, Erin, for continuing to move these forward. COVID has clearly unmasked the system failures, raised yet another time of racial and ethnic and awakening to the issues really before us as a human family on these lands, and suggesting that not only have these deaths of despair been doubling every decade, but and showing us maybe a loss of another 175,000 souls this year, but that we may lose yet another almost 100,000 souls because of the economic and social fallout of COVID, and that this is only deepening right now as we face this. Now, I don't want to get belabored in the data, but it's a reminder, next slide, that this is a fundamentally systemic issue, and that how we are going to find ourselves back to reducing deaths of despair, increasing well-being, joy, belonging, purpose, sense of awe and wonder, opportunities for service, those things that we know build well-being, in addition to meaningful economic opportunity and safe communities and the rest, that it's going to require a systemic response. What back when I was at Kaiser Permanente, we called dose sufficient, enough reach, intensity, and duration for a population level impact. Not a bunch of stray initiatives or grants that tinker at the margin, but frankly, a all-in approach where we bring everything we have to bear, because tinkering at the margin is a bit like raising children by just doing a few of the things that we know we need to do when they need all our love and all our support along the way. And so if we think about stewardship like we might in raising a generation or two, this becomes a systemic, all-in response of a community, which is what I'm so excited about that you're doing in North Sound right now, is that you're committing essentially to an all-in inclusive systems, place-based strategy that is not tinkering at the margin, but is really playing this all the way through. So next, I'll move through this fairly quickly. You know, the systems thinkers say, yes, it's about changing policies, changing practices, and changing the uses of investment capital. And we're going to be able to measure our outcomes. What are those organizational practice changes? Who has made them? What are they and how? What policies have changed that bring more resources to the things that work? And how have we leveraged investment capital, private sector capital to do that? Yes, yes, yes. Underneath that, we know is power dynamics. Healthy communities isn't about projects, it's about power. Who's at the table? How are decisions made? And how are the resources allocated? Which underneath it is, of course, a mental model, which goes all the way back to where Nicole started us. Who are we? Who are we in relationship to each other? What does it mean to actually be stewards, as Stacy was predicting? So I'll just share a little bit, if we might, about well-being trust in this next slide, which is that I'm really pleased to be on this call because we were founded by Providence St. Joseph Health. That is a full partner, I understand, in this initiative. And as being birthed in the Providence family while being an independent 501c3 foundation, we are arm in arm with Providence and helping do good in the communities that it is serving. So while this is my first time really getting to know all of you, I hope this is the beginning of a much longer relationship working alongside Kim and the Providence team to be able to be a full ally, bringing national and other resources to bear. When we were seed funded and given some empowerment by the Sisters of Providence and St. Joseph, we were sort of humbled. How do you reverse the deaths of despair when the data is doubling in the wrong direction every year? And we're given a slice of money, which on the one hand looks big, but a few $1 million a year to do this nationally, we all know it's small amounts of resources. So we said, we have to support what we know about social movements. How do you activate distributed action, right? How do you activate leaders serving from where they stand? And so we said, yeah, we're going to do, to the next slide, we're going to do three things. We're going to try and get the care right, get it paid for, and create the conditions for well-being. What that means is within a delivery system, integrated, whole person care, spirit, mind, body, no wrong door. We're going to talk about your diabetes and your depression about the same time. And until we do that, the care's not right. And if we're not actually talking about food insecurity or housing insecurity or domestic violence or lack of economic opportunity or financial or legal troubles, and we're not helping patients with that, then the care's not right. So integrated whole person care, no wrong door takes on a new definition as hygiene, essentially. Secondly, and what we've been working on most powerfully at Wellbeing Trust is on models that pay for increased access to that care. Just last month, working in California, we helped pass California SB 855. It increased access to care to 13.5 million Californians and created a new gold standard for what enforcing mental health parity actually looks like. And the WIT decision that leaned into United Behavioral Health saying, wait a sec, you are not living up to the law of the land on parity means taking the gloves off and holding health plans accountable. So we have been very strongly on that path to pass legislation that increases access to care and hold providers accountable. And third, even if we get the care right and get people access to care, we know that as Stacy was advocating for a minute ago, that all these so-called social determinants of health, now we language these more as vital conditions for well-being, we need to create gardens to grow people in the first place. If we're not creating the first 1,000 days, potentiation pathways for all young people, we're not going to get it right. And we're going to continue to build more demand for sick care services if we're not creating those dynamics in the first place. So there's our investment agenda. Next slide, moving forward. So we created with dozens of national and local partners a framework for excellence. What does excellence look like if you're trying to move the needle at a population level? Not just do a couple nice things for people, that's all worth doing. But if we're trying to create a population level impact, you got to address community and coverage and care concurrently. And I won't repeat it all, but on the left side there's the vital conditions, right? Living wage jobs, housing, food access, basic needs, access to nature, all those things we know, and expand access to that care affordably, culturally appropriate, and that the engagement needs to be everywhere. We need to have a distributed delivery system that's not only in traditional behavioral health providers at school, at work, in the neighborhood, in senior settings, wherever that belongs, where people are. And that in this way, we find we build out a distributed delivery system and then distribute the jobs so that the workforce is increasingly not only the professionals, the psychiatrists and the psychologists, but we build out that community mental health workforce so that it includes people with lived experience and the community health workers and the promotores and the aunties and the cousins and the aunts and the family members that are all part of the mental health workforce that really build out the access points. So I will just say as we move forward that framework is something that we might be able to build on. Next slide. We built a federal and state policy agenda that points to what really works in healing the nation. I'm now going to fast forward because I'm overstaying my welcome, I'm afraid. The next slide is on the vital conditions for well-being. So what are those? The evidence base is 40 years old. We've got a country who thinks they just discovered the social determinants of health. My God, most of us have been talking about this our entire lives. This is not new. It is time to actually implement what we know. The next slide is, of course, what Stacy and others said so beautifully, that the big opportunity here is identifying the multi-solvers. What are those handful of things that we can do in our communities that can currently renew economic life, renew civic life, and build mental emotional well-being of people? And many of the things you're talking around mental health, food system, housing, the things I've been learning about are all those multi-solvers. We need those multi-solvers at this time. In closing, I'll let you know that we did a report with the de Beaumont Foundation focused on mayors and local partnerships that are solutions for local leaders. Next slide. That are those things that are actually working. And we hope that that is could be guidance of some specific actionable work at the local level, so that you can help build out a local portfolio, which I know you're doing. So again, forgive me for not being that familiar with it yet. But what you're doing is building out a local portfolio, that next slide, that increases belonging and civic muscle, addresses urgent services, but is building those vital conditions for resilience over time. We need to do things dose sufficient, full court press everything we have, multi-solvers that concurrently renew the economy, civic life, and all of us. And remember that we are co-producers of health as human beings. And when we are in healthy relationship with each other, we have the basis for a social movement. My last slide is around the national infrastructure we're building for a national movement to make sure that the pathways and the communication vehicles and the policy structures and the funding structures are in place. I know that with the good leadership there, you are building that local movement and making sure that all of those elements of a strong local movement are intact, just as we're trying to do nationally. I'm going to stop there. I'm so looking forward to the rest of this conversation, and thank you for including me in it. We're with you here for the long haul, and I have a lot to learn from you. So thank you.
Yeah, thanks so much, Tyler. Appreciate your words and your always open heart as you carry and walk along with us. Want to go ahead and hand it off to Trissa to leave us ample time for our collective conversation at the end. So Trissa, please take it away.
Absolutely. Hello, everyone. It's so nice to be with you. I am calling in from the Boston area. Let me start by telling you just a little bit about myself so you know the lenses that I bring and the assets that I'm bringing to this conversation. So I am a preventive medicine physician by background and training, and throughout my career, I've worked at the interface of clinical improvement and community health improvement. I started my career in Flint, Michigan, working with Genesis Health System, and I was there in the Flint community for approximately 20 years, and then transitioned to work for the Institute for Healthcare Improvement here in Boston. I also bring some personal lenses to this discussion. I also have two 20-somethings, similar to Tyler, and my two 20-somethings have, as well as some other people in my family, have struggled with mental health challenges at various times in their life. And so as a parent of that, that is an important lens that I always bring to my work. So if you can go to the next slide. One of the things I'm hoping to share with you all today is I've done work with organizations and communities across the country and around the world, looking at improving their systems to produce better health outcomes, both mental and physical health outcomes. And so I want to just bring some of that experience to share as you all are thinking through your journey to improve mental health in the community and the people that you are closest with. So I'm going to start by saying we have to bring a whole system view. Tyler said this. Here is one view of a system. This is kind of a traditional view of a mental health system, going from prevention to early identification to treatment to recovery, with some efforts to promote flourishing stretched throughout the bottom. One of the things that I often see is people putting a lot of emphasis on the treatment and growing access to treatment, which of course is critical and important. And at the same time, if we put all of our energy into the treatment, then what I worry is the missed opportunities we may have to invest some of our improvement efforts at different parts of the system. And I just want to give one example. I worked when I was at IHI for a few years with the East London Foundation Trust, which is a big mental health care system in London. And when IHI first started to work with them, they said, we want to really work on improving our quality of care and the safety of the mental health care that we provide. So we did work with them on that, and they actually saw significant improvements in their quality of care and their safety of care. But they still saw in their community the prevalence and incidence of mental and behavioral health challenges continue to increase. And so they made a deliberate and intentional move to shift from focusing solely on care outcomes to also focusing on the overall health outcomes. And in that, they started to recognize that social isolation was one of the key variables that they found in every subpopulation and every community that they were working with that related to many of the mental health challenges that they were viewing. So then they chose to shift from focusing just on quality and safety of care to also focusing on what can they do to address social isolation. So let's go to the next slide. So I want to offer to you is a different view of the system. So what you'll see here are the same kind of 5 core elements in those green boxes, but I've reorganized them to highlight some differences. So if we look on the right side, early identification and treatment, that tends to be the aspect within the medical care system, which tends to bring a medical model. And in that medical model, we often see the factors that I have listed here, a medical model which is focused on the individual, which tends to be deficit-based. There is something wrong with you that I want to treat or fix, and often focused on the episodic symptom management. What doesn't feel good now, and how can we help you feel better and or function better? Now, there's pros and cons to this approach, and it is absolutely critical as part of our system. But again, really wanting to call out, not wanting to put all of our energy there, but how can we have a balance of our improvement energy, both on the treatment side, but also on the other side. So I want to spend a little time thinking about the other side of this equation. When we look at the boxes around promoting flourishing, prevention, and recovery, the interventions that we tend to do in that space tend to be more community focused on helping individuals become part of community, building their relationships and their peer supports and the supportive community, leveraging assets, and also looking at a full life course perspective, which includes focusing on the role of trauma and understanding the impact of trauma across our life course. And that means personal trauma, that means trauma from our childhood, adverse childhood experiences or ACEs. It also means intergenerational trauma and historical trauma, such as the impacts of racism, genocide, slavery, lynching, and these historical traumas that are a part of all of our history that continue to contribute to the difficulties that we're all facing, and some more than others. So let's go to the next slide. So if we kind of think of that broader lens that includes both an emphasis on the traditional medical care system and the role it can play, but also the broader lens, there's going to be multiple different areas where you could bring your improvement energy to say, what is it going to take to improve health outcomes in our community? So I wanted to share with you, this is a lot of information on this slide, and this is just to give to you so you can use it to spark ideas as you come up with a plan for what you all are going to put your improvement energy into as you try to improve mental health in your community. But this set of ideas came from a stakeholder engagement that was sponsored by the Wellbeing Trust and facilitated by IHI last spring. And we had a group of stakeholders that we brought together and trying to answer the question, what would it look like? What could we do to try to prevent 100,000 deaths of despair over the next 10 years? And as you can see here, we organized it by that same kind of group of activities, from flourishing to prevention to early identification, treatment, and recovery. And it generated a whole lot of ideas of places where you could drive improvement and drive impact. And as Tyler mentioned, this is not going to be about a project. We need a whole system approach. And you also have to have a place to start, and you're going to need to make some decisions about how you'll prioritize your interventions, and again, where you will apply your improvement energy. So if you can go to the next slide. So one of the things that I find is crucial as, again, in working with a variety of organizations and health systems, and thinking about driving improvement and where you're going to prioritize, where you're going to start and how you're going to prioritize your efforts, to me, it's always critical to anchor in what matters most. So I'm going to just invite us to do a little exercise around this. And so for me, let's start by I'm going to ask each of you to think of someone in your life, whether it's someone you know directly, maybe it's somebody who you've provided service to, or you've encountered in one way or the other, who's experienced some kind of mental health challenge. So I'm going to give you a second to just pull someone specific in mind. And now I want you to imagine how you experience that person when they're at their best, when they're experiencing one of their best days. And now imagine that. And the next thing I want to ask is to say, if you were then to ask that person, what factors matter most in helping you achieve your best state? What factors matter most in helping you achieve your best state? And how might that person answer that question? Now I'm going to ask each of you to type in that answer. So I'm going to speak mine and then give you all a chance to think and type. But for me, the person I was thinking about was my son, who is sitting here at the edge of the ocean. And one of the things that he says to me about what factors matter most to him in terms of helping him achieve his best days, for him, it's about access to training. He does a lot of his expression through physical movement. And so when he has access to opportunities to engage in that physical movement, whether it's jujitsu or parkour or dance or yoga, when he has access to opportunities to express himself through that physical movement, that's what matters most to him. So great, I see people typing in. Let's just give a couple minutes for people to share what matters most through the lens of the person they were thinking about. These are so powerful and I think, again, really help us anchor in the breadth of things that really matter to us and creating conditions for all of us to thrive. One of the things that this reminds me is as we embark on an improvement journey is just how critical it is that people with lived experience are experts in their own experience. And so as we create improvement teams, having people with lived experience at the core of those teams is so, so important. And it's easy to say, and it can be hard to do. But I do want to share an example of where I found it to be incredibly powerful. We were working on some improvement to improve Black maternal mortality, and in 4 different communities across the country when I was at IHI. And what we did in each community was we identified a community organization that worked directly with Black moms, and they brought together many of the Black moms that they worked closely with. They also brought in some additional community partners, and then we brought in the healthcare providers to all sit at the table to work on improvement together. And one of the things that we found was that the Black moms were our most valuable improvement resource. Those Black mothers were the ones who could help us see and understand the system. They could help us see and understand where the problems were, what better would look like, what priorities mattered to them, and really bring ideas for improvement. Now, of course, every stakeholder is an important and key stakeholder, but without the people with lived experience, we wouldn't have gotten it right. So whether you're improving maternal mortality or whether you're improving mental health in your community, always anchoring people with lived experience, which I know you all are already doing. So hopefully this is just a positive reinforcement for some of the work that you're already doing. So if we can move to the next slide. I want to take just a minute and talk about a bit more about underlying causes. So I had the opportunity when I was working in Flint to really learn much more about that community, but it wasn't until after I left that the Flint water crisis was exposed. And I'm sure you all are probably familiar with the Flint water crisis. One of the things that really impressed me about it was how much we emphasized that it was a water crisis, that it was a public health crisis. When I learned about it, I was of course shocked and dismayed, but I actually wasn't surprised. I was very disappointed, but not surprised. And having worked in that city for 20 years, I recognized that it was a very segregated city. What I was surprised about is as all the information came out in the media and as we learned about it from afar, it was never presented as a crisis related to racism, but I knew from my experience in the community that it was. If we go back and look at who was impacted by the Flint water crisis, and we look at the racial disparity of that impact, it went down lines that were created based on redlining, based on, again, racist policies that were impacted over generations or that were implemented over generations that then played out in a public health and a water crisis and has then resulted in ongoing harm. Part of what I wanted to use this example to call out is that we can treat this water crisis. We can now go back. They have, thank God, gone back and switched to a healthier water source, right? So we can treat that problem by getting rid of the bad water source and putting in a better water source. We can treat the children who were exposed to lead and now are going to need ongoing support for the developmental delays that were caused. So we can take a treatment approach. But if we don't go back and address racism as a contributing cause to this problem, then racism is going to show itself again in another community level problem. So I know this is already part of your approach and the way that you're thinking about this. If you can go to the next slide, please. And I recognize that many of you are actually experts in racism and/or you have experts working with you, and I applaud all of those efforts. And like all of you, I'm on a learning journey and there's so much more to learn. And in that journey, I do want to share these two texts that I found extremely valuable. The first one, Caste by Isabel Wilkerson, looks at the caste system in the US based on race and compares it to the caste system in India and the caste system of Nazi Germany. And it calls out the pillars that continue to uphold our caste system of racism. My Grandmother's Hands by Resma Menachem is actually bringing a trauma lens to understanding racism and also to understanding healing and what healing could look like for us as individuals and as a community. And if you can take me to my last slide. So as we kind of wrap up here and are able to move into dialogue, I just want to leave a few kind of thoughts for you all as you consider your improvement journey and how you're going to tackle these issues of improving mental health and well-being in your community. And so here's just some key takeaways that I would share with you, and hopefully they're helpful. One is just a reminder to center the leadership of people with lived experience. The second is a reminder to center the leadership of Black and Indigenous people of color. Again, efforts I know that you already are doing, so I just want to applaud and reinforce those efforts. Always we have to tackle racism as part of every problem that we're addressing, bringing healing methodologies into everything we do. So it's not just about defining the problem, but it's about having healing as part of the way we work together. And again, applauding the efforts I already saw today, starting off with both the land acknowledgement and also with recognizing our human connectedness and being willing to share our pain and hope at the beginning. I would label those as healing methodologies that we can bring to all of our work together. I talked a lot about seeking that balanced portfolio of initiatives that address things that are within the traditional care system, but also reach out beyond that and look at, as Tyler said, across the vital conditions. And then most importantly, I think one of my key takeaways from working at the Institute for Healthcare Improvement was just to learn as you go. We're going to make mistakes. And so let's make some mistakes and learn from those mistakes and continue to learn forward together. So that's all I have for my formal comments. And then I will pass it back to our leaders to take us into some dialogue.
Thanks so much, Trissa. Appreciate all that you've offered and given us to think about, both in what can be and the affirmations for a great deal of the good work that's already occurring in the North Sound region. One of the questions that did come up within the chat as you were inviting folks to think about the factors that support the person that we had sort of centered ourselves on, was wondering if you might re-articulate the question that you had asked of the group. There were some folks who would like to capture that so that they might use it in their work and some of their patient plans.
Sure, I'm happy to type it in and I will quickly articulate. I said, what factors matter most in helping you achieve your best state? I don't know if that's phrased best. You can rephrase it however works best, but I think it helps you get the idea.
Thank you so much for that. Would welcome us to actually move away from the slides and just back into space with one another. And even for those of you who perhaps haven't yet joined us on your camera, if you're able, we invite and welcome you to do so. Would love to open things up, invite you to add and ask questions by using the chat and or welcome your voice in the room. As Tyler and Trissa share sort of the next 15 or so minutes with us yet, want to provide the opportunity for any follow-up that you all have on your hearts and minds. As we give folks just a few minutes to be thoughtful, to add that content in the chat, Tyler was wondering if we might step back to you for a moment and just have you perhaps layer on a bit about some of the additional short-term or pivotal moves that Wellbeing Trust and its partners are looking at in the near term, and how those might be adding up to some of the longer term trend bending ideas.
Sure, would be happy to, and obviously learn a little bit more about kind of what's ripe and ready. Because for me, the kind of the litmus test for what's wanting to happen, what's already emerging that has energy, asset, movement behind it that can build momentum, and so I want to make sure I'm speaking into what's rising, not something from another place. I'll say that for us, the need with the sort of ongoing dynamics around COVID for thinking about ongoing testing and tracing, et cetera, provides room for a safe way to expand that to navigation, so that enhanced contact tracing that identifies food insecurity, housing, we talked about other needs, becomes an entree to, again, live up to that first value I was describing, getting the care right, so that all we're doing to address COVID is also a holistic engagement. And that because we all know that maybe one of the most important human need is to be heard, that we're really listening to people as we're engaging with them in the annoying but vital activities around COVID. So I'll just start with an enhanced notion of what can be done as we try and get our arms around the virus. I have particular interest in what Paula shared. I won't go back into it. I know she shared with you last week. I think what she is doing around the food system is a massive multi-solver. Increase access to fresh, healthy, nutritious calories, create green jobs in the process, tie to clinical needs for those with diabetes or other needs, or those who can't, struggling to get out. There's jobs in it, there's renewal in it, there's equity in it. It's one of those multi-solvers that goes on and on and on when you do it right, and it's rooted in the local economy, right? Local jobs. I think that housing that is stabilizing, creates a sense of belonging. Those people have a key and a place to be and relax, is so important. And for those that are struggling either with some serious mental illness, or like many of us who are experiencing mild to moderate anxiety and depression, or falling back in our addictions during this period, that kind of housing that has the wraparound and the support is base camp. It's like, without it, where do we go? We all know how vulnerable that is. So I think that that's a key one. And I just briefly mentioned this opportunity of what in the jargon, forgive it, is called task shifting. Yeah, we need our psychiatrists and psychologists. Amen. And let's make sure that more people have access to them. But if we're going to really meet the need of the majority of people in our communities, there are jobs for people with lived experience in expanding the notion of who is available to talk about difficult issues, to address addiction, to address the social needs, to be a trusted person. And in so doing, we increase access while giving people an opportunity to serve. There's another win-win there. And when we design such task shifting or expanding the community workforce, if you will, in cooperation with our psychiatrists, it's not an either or, it's a both and, so that we expand access to care by rooting it in the cultural understanding, connection, and all of the community. I don't want to go on too long. And Trissa, I noticed that you were sort of looking at the chat, and maybe you could build on what I said a little bit around purpose and belonging, since so much of this is, how do I know that I'm okay here, and what's something meaningful I can do? As His Holiness the Dalai Lama kept saying, in his recent holiday message, was that our greatest need is to be able to serve, right? So how do we help people find a handle to be part of the solution and tie to premise there? Sorry, Trissa, I think you may want to build on that.
I was just hoping to hear the ideas of others.
Oh, please.
Yeah.
Yeah,
Tyler-
thanks. And Tyler, both you and Trissa have named, right, what is wanting to happen. It's lifting up that Crystal, you've named, that access to care and the resources to access that care is essential. Don't know if you'd like to add any further comment to your note.
Sure. So I know for me, I work with Compass Health and I'm in emergency services. So one of the things that we do is we ensure that every individual that we touch, we make sure that if they are willing and able, we try and connect them with the services so that they're not going from a crisis situation to not having a gap of support. So that's definitely something that we try to follow through with, is ensuring that they have that follow through from going from a crisis to continuing that support. But something that we see quite often just in the mental health field is there are individuals who are uninsured, which really throws a huge gap for us, because before we had funding, we had grants that kind of collapsed this lapse of service, and now we don't. And there's a hope that there'll be some funding coming down because of COVID and the real vision of mental health and how truly important it is. But what does that look on a global sense? How do we accomplish that? Because truly, I look at it as, mental health has become a major epidemic in this world. And we have to try and close those gaps, because unfortunately, the reality of it is the individuals that are uninsured, they don't have accessibility to be able to get insured. So that's really, just trying to get a little more creative and outside the box. How do we get them covered? How do we cover that gap of support that they truly need?
Yeah, thanks, Crystal. And want to invite others who've been thinking deeply about this and working in this area or otherwise from the North Sound. Other thoughts?
My name is Daryl Hilaire, and I need to get off the meeting and go to another one, as we all do. But thank all of you for this time together. And as I listened to the words that were being spoken today, I captured their meaning in the sense that as Lummi people, as Coast Salish people, we're winter ceremony people. And through this crisis, we've been unable to practice our matters of the spirit together. We were having to do this individually now, and it's very much connected to, as somebody said, nature, because we do practice our spiritual life in the forests, in the rivers, in the sea. And we have to do that individually now. And it's been really a challenge to bring ourselves to that connection because we need each other. And it's never more pronounced than in the winter ceremonies in the longhouses, in our smokehouses that some of you have visited at Crab Bay. We're unable to do that now. So I say these things in that, we look for support, and we look for those things that strengthen our spirit and our mind and our heart. And it's gatherings like this, when we bring our whole self to this type of gathering, that we find healing. So I'd like to thank all of you for this time together, and I'll see you soon. Aishka.
Thank you, Daryl. I know that with our scheduling, we provided a few additional moments to be able to spend together and recognize that some of you are likely to need to step off to next meeting, Zoom calls, or other family needs. And Liz, wondering if you may have a few additions you'd like to make sort of in our closing, and know that myself, Tyler, Trissa, and others will be here until 15 after the hour for anyone who has follow-up.
Great, thanks, Stacy. I wasn't expecting that, but I think that from Nicole's starting remarks through the presentations, that where we've been trying to go in North Sound is around how do we build those connections? How do we actually move towards fostering well-being and belonging? And we just see those stories, the boat mishap last night, but every day there's a story like that hits somebody or other that might be sitting on my Zoom screen. And how we make those connections between the things that are impacting our real lives to our work is just really critical, I think, for us to move forward. And as I scan the faces and the names of who's on this call, one of the commonalities I see that these are all people who see themselves as part of community, who see the people that they serve as part of their community, and how we build on that. I think in addressing, whether it's mental health or it's housing or it's anything else, but seeing all of that connectedness, it is one of the strengths that I see in North Sound, being now just hit my full year anniversary up here. There's so much that we want, possibility of intangible. So just have appreciated the last hour. And Tyler, since you opened up the door that there's more to come, I can't wait to hear what the more to come is. So feel free, you are now part of the North Sound community, and we'll take whatever we can get out of those conversations.
I'd welcome that, Liz. And I do, sorry, I have to go do something with the HHS. We're trying to inform the transition team. But I know we're going to have a call relatively soon, and I would love to learn more and listen more so I can be a better ally. And it's so good to see all of your faces and hear some voices, and know that your friend in Oakland is with you. And
Great, thank you.
Thank you all.
Yeah, and thanks, Stacy, for pulling this together. So appreciate that, and what happens in part 2.
Look forward to it. Just a reminder that we will have the opportunity to come back together again December the 9th to continue the conversation, and really look forward to the local voices and being able to go deeper with the great progress and the many ideas that are being advanced around the North Sound region. So anyway, wish you all a healthy afternoon and rest of week. Be well.